Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 updates. And let me just see what's happening with the numbers. Sorry, I'm a little bit behind this morning, so I'm trying to catch up here. So it looks like right now we have a total of 77 cases that have occurred since March 15th. 47 of those cases have recovered. Total of 22 are currently in the hospital, or are currently considered active cases. I shouldn't say in the hospital. Currently active cases. 5 people have been lost in terms of the follow-up. And then that leaves 2 people that are currently in the hospital, and 1 person has deceased. So again, total of 77 cases since March 15th. 47 have recovered. 22 are currently active. 5 people have been lost during the follow-up. 384 people have tested negative overall, and 2 people are currently hospitalized, with 1 person who was deceased. Taking a look at what's happening on the county side, a total of 5,567 cases are currently active and have been reported in Norfolk County. That have been reported in Norfolk County. Total of 13,417 cases in Middlesex County, 12,140 cases in Suffolk County. The 5,567 number seems to be leveling out a little bit, but it's good to see that is, even though it's still climbing, it's still going at a much slower rate than it was, which is good to see that. Happening around the Commonwealth, there are 18,200 COVID-suitable beds. 3,856 individuals are actually in those beds at this time, are considered COVID patients, and 1,011 COVID ICU patients, and that number is stabilized as well. So it's good to see that's happening. Let's take a look quickly at what's happening in and around the Commonwealth. Just a couple local things to update you on as well. Just an announcement to just remind people that it's unfortunate, but we have to announce that the Founders Day has been canceled due to the COVID-19 pandemic. Hopefully, we certainly hope to be able to follow up with that next year, and many years after that. So I'm not sure if this is the first year it's actually canceled for any particular reason in quite some time, but I know it's in the time that I've been here, this is the first time it's been canceled. So very unfortunate to be able to report that, but that is actually something that was in the newspaper this morning. Also announced that the fishing derby the day after Founders Day and the Touch a Truck program that was put on by the Recreation Department has also been postponed this year, given the circumstances. These are, as it was noted to me by the Recreation Department, that these are sad announcements but true, and unfortunately, excuse me, we're going to have to report that out to you, that these things have been postponed for the time being. Also, taking a look at what's happening in and around. Also, one other thing I just wanted to report out last night, if you weren't able to watch on live TV with the Board of Selectmen's meeting, I did report that I've made some substantial cuts to the budget for next fiscal year, starting on July 1. So one of the things that obviously our revenues are going to be down, so we had to make some changes. Adjustments were made to our estimated local receipts, also to state aid, and to what our new growth estimates were. Those are 3 significant elements of the budget process that we have to consider when building the budget. And so I've actually taken it down about $2.5 million as a result of what we believe to be the reductions in state aid, in local receipts, and new growth. That said, I've also reduced the spending side of the budget too, having reduced significant amounts, equal amount on the spending side. So I'll be reporting that again tonight at the advisory committee meeting, which will also be televised. So if anybody wants to tune into that to see what their reaction is to that. The Board of Selectmen did support the budget as submitted, and also supported the reduced capital plan that was submitted as well. And they did support the warrant now, which, by the way, only reflects 11 articles for the town meeting, which will be held which will be held on June 15th at this current time. That has got to be one of the lowest warrants I think I've seen for an annual town meeting in the 37 years that I've been doing this. I've not seen one that small for an annual town meeting. So that's reflective, of course, that we're trying to get the town's business done as efficiently as possible and not get too focused on articles that will take a lot of time, so we can get people into the meeting and out of the meeting reasonably at a reasonable time frame. Looking at the town manager update for today, April 29th, Tuesday, the governor announced that the stay-at-home advisory on essential services will be extended until May 18th. I think most people are aware of that by now, but in case you haven't seen that, it has been shifted from May 5th to May 18th. Actually May 4th, I think it was, to May 18th. The state has formed an advisory committee on public health officials, municipal leaders, and industry representatives to develop a plan for phased-in reopening of businesses in Massachusetts. The first meeting was held Tuesday. Just on the local front, we are actually doing the same thing here. We're actually working with our Board of Health and with various town departments to get ideas on how we can best reopen the town government once we get the green light to do that. We're doing that, we're making those plans now, obviously, because those days, that time to reopen could be as early as 3 weeks from now. We want to try and make sure we're prepared for that. The health department has been tasked with supplying guidance for the eventual reopening, which they have been doing, and also along with recommendations and ideas from other departments as well. Massachusetts Department of Public Health shared that they have become aware of scams where callers identify themselves as being from the health department or the community tracing collaborative and called about COVID-19. The caller then asked for a social security number, and the Mass Department of Public Health, the CTC, which is the committee not to be confused with CDC, is and the Foxboro Board of Health will never request that kind of information. We will not be asking for social security information, so do not give that out live over the phone. Obviously, people are trying to take advantage of this in a most unfortunate way, and certainly if we do catch those people, we will handle their penalties very, very abruptly and very significantly if we catch them. It looks like that just in terms of the MRC email, I'll give this to you briefly this morning, that there are 58,302 confirmed positive cases of COVID-19 in Massachusetts, with over 1,840 new cases and 3,153 deaths as of yesterday at 4 o'clock. The 1,840 new cases were a little concerning because it was looking as though the cases were leveling out in the 1,500 range for the past several days, and then most abruptly yesterday it bumped up to 1,840. So we'll have to take a closer look to see if in fact that trend continues today or not, but hopefully it goes back to where it was. Overall, 254,000 tests have been conducted by the public and private sources. The Department of Public Health has regularly released a daily reporting dashboard containing detailed information, hospitalizations, demographic data, and county-by-county breakdowns of cases. So just a little more information dealing with the governor's order. Obviously, it was extended through May 18th. Prohibition. This includes prohibitions of gatherings of 10 people or more, closure of non-essential businesses, which that list has already been well established, so there shouldn't be any differences with that. And as a reminder, the list of essential businesses can be found at the mass.gov info details /COVID-19 essential services. More information on the reopening advisory board, including a list of members, can be found at mass.gov/news. Baker Polito administration extends non-essential business closures to May 18th, announces. And in terms of healthcare, hospital capacity as of 4/27, 54% of the Commonwealth's 18,200 beds, permanent beds, and temporary hospital beds are available for new patients if needed. In terms of PPE, continues to be distributed, with including 210,000 N95 and K95 masks and 136 ventilators were issued across the Commonwealth as of yesterday. Mobile testing, the National Guard Mobile Testing Unit continues to visit and conduct tests at the Commonwealth's long-term care facilities, having made 433 visits and conducted over 19,699 tests as of 4/27. And let me see. Following yesterday's announcement of supplementary nursing home funding, the administration released the 28-point infection control checklist that facilities will need to comply with to receive funding. Facilities must satisfy at least 24 points to be considered compliant, and 6 of the control measures are considered core competencies required of all facilities that receive funding. And yesterday, the Department of Public Health issued guidance expanding the list of entities that can make referrals to clinical laboratory testing for COVID-19. The Board of Registration and Pharmacy has issued a new order governing best practices for infection control in Massachusetts pharmacies if staff test positively for COVID-19. Unemployment assistance to assist the employees who may not be sure if they qualify for pandemic and unemployment assistance. The Executive Office of Labor and Workforce Development has released a simplified eligibility checklist for individuals to check and see if they are covered by the PUA. You see, the administration released detailed guidance on farmers markets and farm stands. I've since forwarded that information over to the Board of Health as well as to the Recreation Department to see if they can somehow pull together a farm stand presence this year or not. There are some pretty restrict requirements of that, so we'll see how that works. But hopefully, we'll see if we can get that working. Let me see. The House of Representatives is in the process of adopting temporary emergency rules to allow the full formal voting sessions to be conducted remotely. During the state of emergency throughout the crisis, the legislature has been holding regular informal sessions to advocate to advance legislation where the body is able to pass bills by unanimous consent. Okay, I think those are the key elements that I wanted to just remind you that we do have a stay-home advisory in place that's still ending May 18th. And to the extent that if you can stay home, certainly do that. We're trying to do the best we can. You can see that from our meetings last night. Trying to do as much remote meeting as possible. Even some members of the board, a member of the board is actually doing the meetings entirely remotely. Others have chosen to be there, but with social distancing, of course, in place. And then also we've tried to maintain the rule of no more than 10 people in the room at any one time. And so that wraps it up for today. Those are the highlights for what's going on in and around Foxboro and around the Commonwealth relative to COVID-19. Certainly want everybody to stay safe. Great day today, so get out there enjoying the weather. This week looks a little bit rough for the next few days, but then looks to be clearing up a little bit on Saturday, and then Sunday hopes to be a really nice day. So try and get out and enjoy the weather if you can. Until then, stay healthy, stay safe, and we'll see you next time.